The Israeli military is keeping up its assault on Lebanon, where it says that it's targeting fighters from the militant group Hezbollah. The latest strikes have hit sites in the south close to the border with Israel, such as here in the ancient city of Tyre. Lebanon's national news agency says that 2 people died in those strikes, with 2 more killed in a separate attack farther north. Lebanon's health ministry says that the death toll from more than 2 weeks of Israeli attacks has just passed 1,000. The World Health Organization says more than 100 of them are children. Well, the fighting between Israel and Hezbollah has caused a humanitarian crisis in Lebanon. The UN has warned that it's becoming increasingly difficult to provide aid to the people who need it, and more than 1 million people, or 20% of the population, have been displaced, mainly from the south, including from Lebanon's 5th largest city.
Tyre is a ghost town. On Tuesday, Israel issued an urgent warning for residents to evacuate. 60,000 people lived here just a few weeks ago. These images were filmed by a French news team on Wednesday. Almost no one is left. Tyre has been a Hezbollah stronghold. The flags of the militant group are still flying. It's been repeatedly hit by Israeli airstrikes over the last few weeks. This is what's left of a bank branch associated with Hezbollah after Israel bombed it. Since the start of the war on March 2nd, Israel has issued several evacuation orders for southern Lebanon. First to the Litani River, then later to the Sarani River. More than 1 million people have heeded the orders and been displaced. In Beirut, people are sleeping on the streets. Some have tents, others seek shelter from the winter weather in their cars.
I sleep in this small van, no water comes in. I just close the doors and lay out the mattresses. Some people sleep on the front seats like it's a living room, and back here it's like a bedroom. And on the top I put all the preserved foods.
There is suffering caused by this forced displacement. People being driven out of their homes and their areas. We're out in the open, facing rain, winter and cold. There is definitely hardship.
Elsewhere in Beirut, people find shelter in this school. The classroom is decorated for Ramadan. Many had hoped that they might be home for the feast of Eid al-Fitr. But as the holy month draws to an end this week and the war is escalating, there is little to celebrate.
And earlier I had the chance to speak with Dr. Ghassan Abu-Sittah. He is professor of conflict medicine and plastic and reconstructive surgery at the American University of Beirut Medical Center. I asked him what life has been like for him as a doctor since the war started nearly 3 weeks ago.
So from the first day, we were designated by the Ministry of Health in coordination with UNICEF as the referral hospital for all children wounded in the Israeli attack. And so we have been receiving a stream of very critically wounded children on a daily basis to our hospital. And these children need, some of them are in intensive care. All of them need repeated surgeries. And so it's been almost daily surgery since the war started. And the numbers of children critically wounded in the hospital keeps mounting day in, day out.
You're speaking a lot about children, and I'm just wondering, can you give us also a little bit of insight, because Israel is saying that it is targeting specifically Hezbollah fighters. Do you also have that impression based on who's coming into the hospital?
Absolutely not. We are getting families who are absolutely devastated by these aerial attacks on their homes. I have 3 sisters, all in their early teens. Their 4th sister was killed, and their mother is also critically wounded in intensive care. I have another 2 sisters wounded. Their mother has been killed. I have a 3rd girl whose young brother was killed. I have a 4-year-old whose mother was killed when she was on her lap, and the girl came in with shrapnel in her face and in her eye. So what we see in our hospital is families whose homes have been targeted and bombed, and children whose lives have been destroyed, and families completely ripped apart.
What about the hospital itself? I'm wondering, what your scenario planning it is right now, and how safe you feel it is there for the staff and for the patients.
Unfortunately, for our colleagues, a lot of them have had to become displaced as part of this war. In terms of safety, I on the 17th of October 2023, I was at Al Ahli Baptist Hospital in Gaza when it was bombed by the Israeli Air Force. And so for me, the idea of safety in this region is a falsehood. The worst thing about what's been happening is that you get the sense that we haven't even peaked in terms of the intensity of this war, and that things are going to get worse before they start getting better.
You mentioned your experience in Gaza, and I'd like to just ask, before we move on with the conversation, can you just compare with us, the experience that you're having right now in Beirut, comparing it with what you witnessed in Gaza?
So the similarities are this destruction of families. I mean, I remember in October 2023, we started seeing these wounded children who had no surviving family left, parents and siblings wiped out. And we're starting to see a similar pattern in Lebanon. The scale is not still that of Gaza, but the Israeli defense minister has said that he wants to turn the southern suburb of Beirut into another Khan Yunis. And so the fear is that we are going to continue to witness this onslaught, and children will pay the price. Currently, 25% of the wounded are children, and around 116 children have been killed since the beginning of the war, almost 16 days ago. And so this high proportion of children wounded and killed in this war does not bode well, and looks like heading towards the percentage that existed in Gaza, which is around 35 to 40%.
EU leaders are meeting in Brussels today to discuss the war on Iran and, the strikes in Lebanon, which you have been detailing. What would be your message to them? So
before this war, I was working on a project with UNICEF, treating the 1,400 children wounded in Israel's previous war on Lebanon. And then a further 70 children who were wounded in Israeli airstrikes during the ceasefire. So in the 15 months after the ceasefire was signed between Lebanon and Israel, Israeli air raids wounded a further 70 children. There needs to be a permanent stop to Israeli attacks on Lebanon. There needs to be a plan for the region, which has seen 3 years of continuous Israeli attacks, not just in Palestine and in Lebanon and in Syria and now in Iran. That needs to end. This is a war being waged on the children of this region. And we have ended up with a whole generation of war-wounded and disabled children as a result of this war.
Thank you so much for joining us to share that view, Dr. Ghassan Abu-Sittah at the American University of Beirut Medical Center. We appreciate your time.
Thank you.